My name is Rebecca Britt, and I am a general and acute care surgeon at Eastern Virginia Medical School in Norfolk, Virginia. This year at the college, we're rolling out our Speed Mentoring Program. This is a collaboration between the YFA, RAS, and the Women in Surgery. And we're excited that we've been able to match 60 RAS mentees with 60 mentors from the college. We have a combination of senior leadership at the college as well as YFA members serving as the mentors. Each of the mentees is going to have the opportunity to meet with 5 different surgeons in practice to ask a question based on some criteria that they selected as far as their areas of interest. So we're very much looking forward to our inaugural program and hope that this will continue to grow in the future. I have chaired the Advocacy and Issues work group for the YFA for the past year. I had previously been on other work groups within the organization, but got involved with Advocacy and Issues in the last 12 months. What we've done is try and reinvigorate some enthusiasm within the young fellows for advocacy, and also try to identify some issues that we think are particularly relevant to young fellows to see if we can perhaps make some toolkits or information available to them that otherwise is somewhat more difficult to find. We've done some really innovative programs in the first year. We had a YFA networking breakfast at the Leadership and Advocacy Summit where we had 25 of our young fellows who had an opportunity to then meet with some of the leadership in the college and advocacy, and also network with other young fellows who were interested in advocacy. Some of the other projects that we worked on in the last year, we did a essay contest, and we actually were able to award our winner with coming to the Advocacy and Leadership Conference. We got them a tuition-free conference as well as a stipend for travel, which I think was really fantastic. Before I was on the YFA, I didn't really know a tremendous amount about advocacy. The Virginia chapter actually sent me up one year to the Advocacy and Leadership Conference as the young surgeon. And that was really my first opportunity to learn a little bit about advocacy and actually go up on the Hill and do some networking. As I've gotten more involved within the Advocacy and Issues work group over the last year through the YFA, it's really opened my eyes to all of the things that the college is doing for us in advocacy, from an advocacy standpoint. Being part of the YFA advocacy work group has allowed me to network with some of the leadership in advocacy within the college and realize the tremendous resources that they have in terms of advocating for us as surgeons, which I wasn't really aware of. It's also given me the opportunity to help other young surgeons network amongst each other who are interested in advocacy and issues, and try and help pull people together with similar interests from different parts of the country, all of us as young surgeons working together to help advocate on the behalf of surgeons. So the YFA advocacy work group is open to anybody who's a YFA member and wants to be a part of it. We have monthly or every other monthly conference calls, and we've had a lot of enthusiasm on those conference calls. Again, people from around the country who are interested in both advocacy issues locally within their own area as well as nationally. I think it's a fantastic group of energetic people, and I would highly recommend people get involved if they're interested in advocacy. I think it's a great avenue to have your voice heard.